Today, we're diving into a topic that is absolutely crucial for your long-term health, but honestly, it's often misunderstood. It's called preventive cardiology. And this isn't about reacting to a heart problem, it's about getting way ahead of one before it even has a chance to start. So let me ask you something right up front. Can you be at risk for serious heart disease right now, even if you feel totally, completely fine? The answer? Well, it might just surprise you. And it really gets to the core of everything we're going to talk about today. All right, here's our game plan. First, we're going to uncover this invisible problem of having a risk you can't even feel. Then, we'll get specific about who actually falls into that high-risk category. After that, we're shifting straight into solutions. We'll lay out a proactive care plan, tackle some common questions, and finally, talk about how you can really, truly take control of your heart's future. Okay, let's start with this big idea. Some of the most serious risks to our health are the ones we can't see or feel day to day. And when it comes to your heart, this is especially true. This is such a critical point. For anyone dealing with conditions like diabetes, obesity, or who just has a strong family history of heart problems, the risk can be building up silently for years without a single warning sign. You could feel great, totally energetic, but inside, your body might be telling a very different story. So who exactly are we talking about here? Who falls into this high-risk group? As we go through this next list, just take a second and think about whether any of these might apply to you, or maybe to someone you love. Okay, so you might be considered high risk if you have type 1 or type 2 diabetes, are dealing with being overweight or obese, or have high blood pressure and that bad cholesterol we hear about. A huge one is family history, like if your mom, dad, or a sibling had heart disease early on. But it's also about lifestyle, like smoking or being under constant stress, and even other health issues like chronic kidney disease, PCOS, that's polycystic ovary syndrome, or a history of pregnancy complications like preeclampsia can play a big role. All right, so we've identified the risks. That's the first step. Now, let's get to the good part, the solution, a proactive care plan. This is where we stop just talking about problems and start actively protecting your future. And here's the main goal. It's really two things. First, it's all about early detection, catching any tiny changes before they become big problems. And second, it's about creating a personalized plan to lower your risk. This is not some one-size-fits-all handout. It's a strategy designed specifically for your body, your genetics, and your life. So what does this process actually look like? Well, it's a clear path. It starts with detailed risk scoring, so we know exactly what we're working with. Then comes an early heart assessment, using tools like an ECG to check your heart's electrical rhythm, or an echocardiogram, which is basically an ultrasound of your heart. From there, it's all about personalized guidance. And finally, and this is key, ongoing follow-ups to make sure everything is on track. It's a journey, not a one-time fix. I love this because it gets right to the point. Taking charge of your health shouldn't feel scary or overwhelming. It should feel empowering. The whole idea is to give you clarity so you feel confident and in control. Now, I know whenever we talk about being proactive with medical care, a lot of questions and maybe some worries can pop into your head. So let's just jump right in and tackle a few of the most common ones head on. Here is a huge one, especially for younger people. Maybe you're in your 20s or 30s, you have diabetes, and you're thinking, cardiac care? Seriously? Isn't that something for way later in life? It's a totally fair question. The answer is a definite yes. And here's why this is so important. Diabetes can actually speed up the aging process of your heart and blood vessels. So by starting to monitor things early, you can massively improve your health outcomes for decades to come. Think of it as an investment in your future self. Okay, this next one gets at that feeling of, well, it's in my genes, what can I do? If heart disease runs deep in your family, it can really feel like your fate is already written. So, can you actually change your story? Absolutely, 100%. Your genes are not your destiny. Look, they play a role, of course, but your lifestyle choices and the medical care you get have an incredibly powerful impact. You have so much more control than you might think. This is a tough one, but it's something so many people feel. You've tried to lose weight before, you've struggled, and the thought of trying and failing again is just exhausting. So can a program like this actually make a difference? Yes, it can. And here's why. The focus completely shifts. This is not about perfection. It's about figuring out what is realistic for you and your life. Because you'd be amazed, even small, consistent changes can lead to huge benefits for your heart. It's all about progress, not perfection. So let's bring all of this together. We've talked about the hidden risks, we've laid out a plan of action. Now let's focus on the most important piece of the puzzle. You taking control. This is where the real power of prevention comes alive. Because ultimately, this is all about empowerment. It's about shifting from a place of uncertainty or worry to a place where you're making confident, informed choices about your own health, knowing you've got expert support with you every single step of the way. And this last thought really says it all. Being told you're high risk does not mean you're helpless. Not at all. It simply means you have crucial information. And with that information comes the power to act. The right team is there to guide you and partner with you, never to judge. So as we wrap up, I just want to leave you with this question. You don't have to change your whole world overnight. But based on what we've talked about, what's just one small choice you can make starting today for your long-term heart health? Thanks so much for tuning in.